For this video, we were trying to find stats about mental health, but we ran into a problem. It wasn't that we couldn't find the stats or credible sources, but it left us with a lot of questions. One website said in 2012, approximately 2.8 million Canadians had at least one mental illness. The problem with this is that it is almost 3 million people who were able to step forward and seek help. But what about those who couldn't? How many more Canadians had or have a mental illness? And how many people all over the world have mental issues? Could there possibly be a billion? If so, then why is it still a taboo subject? Why are people afraid to speak up? And why are stereotypes still the only thing most people know about mental illnesses? In short, why are we all so ignorant?
It's a term used to group anything from any type of mental illness that affects your quality of life.
I'm not a doctor and I don't know the official definition, but I'd say a mental illness is something that doesn't allow you to function in a productive way in your job or at school, and that it's connected to your brain activity.
In my opinion, I guess a mental illness is anything that would prevent someone from leading their daily life in a normal way. Anything that would affect them, whether that be anxiety, whether that be some things that would lead to other physical illnesses. So basically anything that would prevent them from leading a normal everyday life.
People who suffer from mental illness or even mental strain are very afraid to admit it, especially adults, because I think it's a sign of weakness. They think it's going to be seen as a sign of weakness and that people won't respect them for it or understand it.
Definitely. I think they're definitely afraid to tell someone, and I think the reason one of the reasons that it's hard for someone with suffering depression to tell someone is it's almost in their minds admitting that they're unable to cope with everyday lives. When we live in a culture that says that you have to be self-sufficient, you have to be able to deal with things on your own, that by telling someone that you're going through struggles is almost to them like admitting failure. And I think that makes it difficult, although it's not a failure.
There's a stereotype or there's a stigma around mental health and mental illness, that people are afraid to do that because people will label them as freaks or other nasty kind of names and things. That's completely untrue. Some of the greatest people in our societies have been at different times in their lives, they've had depression issues or different mental health issues. So it's unfortunately true that people don't like to admit it because they're afraid.
That's a good question. I think a lot of times when dealing with mental health, I think people are maybe they're embarrassed, maybe they don't want to be labeled a certain way, maybe they don't want that stigma that comes with it. I think mental illness is one of those kind of things in society where if people are already feeling embarrassed and bothered by that, they're not going to open up, they're not going to want other people to find out that they're dealing with that. Right? So, yeah.
Yes, there's the more severe the mental illness, I believe in some ways the more severe the. I think when they think about disorders or when they talk about disorders, they're accepting, but when they confront people with disorders or when they operate in their daily lives, I think they're less accepting of mental illness.
Yeah, I think people are very prejudiced against people with mental illness, and that's one of the reasons people won't admit it. And I think teenagers, there's even more pressure to fit in and be like everyone else, so I think it's really hard for them to admit it.
I think that people you're very welcome. Shy away from or criticize things that they don't know very much about. So yes, definitely.
I don't think they are. I think everybody knows somebody in the family who is struggling. But I think the person who's going through it believes that there are prejudices out there. But I don't think that people really truly do have a lot of prejudices out there.
More. I think you can't have physical health without mental health.
I think mental health and physical health are definitely connected. If we use the computer as a metaphor, the CPU, or the central processing unit, is your brain, which has to be in a healthy body to make healthy decisions. So I do think that they are definitely linked.
I think it's more important because I think you wouldn't even know that you had mental or that you had good physical health if you didn't have positive or, if you weren't mentally well. And what I mean by that is there's lots of people who aren't healthy, but their minds say they are, or there's people who, you need to have a healthy mind in order to have a healthy body. So I think it's actually more important.
It is important. We are holistic beings. We have the mental side, the physical side, the spiritual side, and if any of those three are out of balance, then we are out of balance. And so yes, it's very, very much as important.
It's probably more important than physical health. I think if you have healthy mental self-esteem, physically you feel better. And if you feel poorly, if you feel down on yourself, a lot more of the physical ailments, you're tired all the time, injuries happen a lot more. So I think it is a little bit more important.
I think yes, the more aware they are. Now, the one thing that I would add to that is there's two types of awareness. I think we've been really good in our societies of bringing public service announcements forward or bringing legal changes forward, but it's now more the everyday lifestyle, the way that we accept people in our lives, and I think that's the type of awareness that we need to grow more, is to familiarize ourselves, to converse with people who may struggle with it, and to open our minds to that. Oh, we need to do a lot more. I think in my estimation, we've done the easy things. Like I said, changing legislations or putting it out there and helping people learn the definitions. That's easy, but how do you open someone's mind to interacting with someone with mental illness? That's where we struggle, and that's where I think our energies need to be.
Well, that they make you different, and perhaps if you have a mental illness that you don't fit in, or that you can't get over your mental illness, or that it might not be treatable.
I think the biggest, I think the most harmful stereotype is that mental health or mental illness is a choice and that someone would choose to be not mentally well. And I think we need to understand that it's not a choice.
If people hear that someone has a mental illness or something, there's kind of like a negative stereotype to it, that they're kind of like ostracized or there's something wrong with them, but really 1 in 5 people will experience depression and some sort of mental illness in their lifetime. And by 2020, it's going to be the #1 cause of disability. And so it is something that doesn't discriminate. It doesn't matter if you're a doctor, a lawyer, or whatever. It can hit anybody at any time. So rather than having a negative aspect to it, I think it's coming out more and more that it's something that needs to be dealt with on a more healthy level, in a more open way.
Well, and we know that this happens in the high school environment. It actually happens more than we may be aware of. I'm not a psychologist, so I wouldn't try and help them directly. I would direct them to somebody who could help them, for sure.
The first thing I would say to them is that congratulations for being able to say it out loud. Congratulations for being willing to ask for help. And then I would help them by, couldn't do it personally, I'm not trained, but I would send them in the right direction to guidance counselor, and we have social workers and youth care workers. And I think the idea, trying to make them feel good about themselves for getting help is rather than trying to hide it and be embarrassed about it. I think it's important too that students, high school students who see their friends and think their friends might be suffering, they're often the first ones to know or to understand that it might be happening, and they need to bring it up with the person and actually talk to them. and then help them go get help if they don't want to do it alone. But I think it's really important it's really important to talk about it. That's what I want to say.
I would give them the same advice I'd give somebody that came to me and said, my appendix is hurting, my leg is hurting. I would help them to get connected with a family doctor and try and find someone that would be able to help them with that.
What advice would I give a student in that situation? I would certainly try to help them, point them in the right direction, and if it's not something that I can deal with myself, something that I'm not necessarily qualified to diagnose or deal with, then I would certainly point them in the right direction, whether it be guidance, whether it be outside counseling, or other healthcare professionals.
I would point them in the direction of a guidance counselor for
I
sure.
would give them to go to the doctor. Go find their family doctor and talk to them. The doctor can be the best person to prescribe either medication or prescribe some help with a psychologist to help them.
Anything else you wanted to add?
No.